The article for this week's topic on internet web searches for opioids and how it predicts emergency department heroin admission is, I think, greatly beneficial in the healthcare sector. The use of these internet search data provides efficient, low cost, and real time data source for monitoring and potentially predicting possible public health outcomes. In recent models of utilizing internet search and social media data, has been shown to improve previous limitations in the past. In the setting of public health clinics, healthcare organizations, and government agencies, these organizations utilize these data to implement plans and approaches to monitor and prevent diseases using predictive analytics. I think in the case of heroin related admissions, the use of internet search data provides a valuable source of data by helping doctors and emergency departments predict and potentially find the signs or red flags of patients. Because unlike social media, which has the potential to convey people's thoughts and emotion, internet search data is based on determining patterns in online search behaviors by looking for keywords. I believe this is helpful in enabling more insights to social behaviors to predict admissions into emergency departments and develop methods to help and prevent further crises.
Hi everyone, I'm Lauren, and a topic that stood out to me in lecture was the Waze traffic app. I think a lot of people use it more than Google Maps or Apple Maps because it is a user-generated app and it allows you to see real-time traffic based on the users that constantly update it. And I just think that people use it more because it's more reliable and it's more convenient and it has more options. Like you can see the exact time that you should leave in order to reach your destination at a certain time. And I think that Waze is just an example of how we have become so dependent on technology. And I think that sometimes it can come at a cost of our privacy. Like, for example, in order to use Waze, it asks for permission to access your messages, your contacts, your photos, and even your call information. So I think that it's just important to realize that anything we do on our phones or put out on the internet is subject to being used as data or can be seen by other people. And I think that our discussion in lecture was pretty accurate about how we are aware of that and we refrain from posting things like partying or alcohol or just things that are seen as inappropriate by people like our future employers on Instagram or Facebook. And I think that it's just a reminder of how we should be aware of what we post and what personal information we give apps permission to access.
After reading about this week's topic on artificial intelligence and machine learning, I think that the use of predictive analytic is largely beneficial in the medical field, especially since a lot of other occupations today have already begun integrating AI and technology into their regular work, enabling them to do their job in a more efficient manner. In terms of this technology in the healthcare industry, the results of predictive analysis algorithm may be able to compromise physicians when helping out a patient to decide on a treatment. So for example, if a patient walks in with a minor bone fracture, these predictive analysis algorithm, along with the doctor's professional judgment, would be able to come up with the best treatment as to whether or not that specific patient would need to undergo surgery or would a simple cast be enough for the patient to heal. But again, I really want to emphasize that this is a really good technology, but it does have its limits. And if anything occurs that may be kind of like beyond what the doctor's professional judgment may think it's correct, then I think that the doctor's judgment should definitely overtake what is provided with the predictive analytics, especially since it's because these predictive analytics don't have like firsthand exposure to the patient's current state of health.
Hi, today I'm be talking about the article concerning predictive analytics and its role that it plays in clinical care. And overall, after reading the article, I feel like PA can be used as an extension of physicians' knowledge to ensure that patients are receiving the best quality care and treatment plan, but not necessarily as a replacement for care and diagnosis. For example, it could be used as confirmation to double check that the physician is making the correct decision or kind of lead them towards the right path in doing so. But overall, by relying solely on predictive analytics, I feel like it can eventually create a distrust between the patient and doctor, being that treatment would become less individualized and that can therefore lead to discrepancies in care. Since every individual is different, they also have the potential to respond varyingly to different treatment plans or have strong opinions about what treatment plans they want to do. So ultimately, I feel like I support predictive analytics in aiding physicians and the knowledge that they have, but not completely as a replacement for the knowledge that they do.
The first article highlights the emerging issue of opioid and heroin abuse. New methods can be implemented to monitor the use of opioids, both prescribed and non-prescribed, to prevent hospitalizations due to heroin use. I learned the power that internet search data has to put an end to this opioid epidemic. In the study, it was found that there were differences in the various regions that searched for opioid-related information versus those that didn't. In the next article, I learned how big data can help predictive analytics, which will help our physicians. Predictive analytics can forecast future events using advancing technology with machine learning and AI. Physicians must then use this information to develop algorithms and models while making sure appropriate samples of patients were taken and if there were any conflicts of interest. I thought it was great that in the first article, the research was based on data gathered from 9 cities across the United States. In today's world, social media is an integral part of a lot of people's daily lives. I think that tracking tweets like the ones shared in class or Instagram and Facebook posts is a really smart and efficient way to utilize this data for the greater good of the public. People tend to overshare on social media, so using this data to potentially forecast and prevent opioid-related crises is extremely beneficial and important.